Hi everyone, this is Jacqueline Haneke, and I am doing my presentation on stroke survivors. Why stroke survivors? So, when I was younger, I used to volunteer with my aunt a lot. She worked in an elderly home, and I would go with her in the summer and volunteer. And they were like my best friends. I would hang out with them. And there was one in particular. Her name was Margie, and she had a stroke. And I remember thinking, oh man, I want to get her right side to move. She had a stroke and it affected her right side. And so I would spend time with her. We would play tennis and um, I would sing to her. We would dance and I would try to get her to hit the drum. And I remember thinking, oh man, I wish her right arm moved. And I remember at the end, the nurse would come up to me and say, oh, you got her right arm moving more than it's been in a long time. Yes, that was like a victory for me. The second reason is my aunt Rosa. She's in the picture with me and my husband, and she suffered a stroke about 4 years ago. It was a mini stroke. Nobody knew, and we were not sure what had happened. Her personality changed. She lost her hearing. She started to get vertigo very often, and became really depressed for about 2 years. Um, it was very sad because she almost wasn't herself. I think part of it was just not knowing that she had had a stroke. And I think the frustrating part is when something's going on with your body and no one can tell you why. But eventually, about 2 years later, after a bout of depression, someone tested her and was like, hey, you have a stroke. And she was like, what? And after I look at the symptoms and whatnot, it starts to make sense. But she got treated for it properly, and she's doing way, way better, which I'm excited to say. She's one of my favorite aunts. But yeah, it motivated me to be like, what can I do as a music therapist to help stroke survivors? What is a stroke? So there's two kinds of strokes. There's embolic and thrombotic. And embolic stroke is more common, and basically a clot is lodged in your artery, and it prevents the blood flow, and it causes an immediate physical and neurological reaction, which you can see is evident when as a person has a stroke. Most of the time, obviously, we didn't know it was my aunt, but there were symptoms that were happening, and a few common signs of stroke. Just the weakness in the face, arm, or leg. That's the on the side that has been affected. Warning signs can include numbness of the arm, face, or leg, confusion, trouble speaking, trouble seeing in one or both eyes, walking dizziness. My aunt has a lot of dizziness, and also headache. Medical conditions that increase your stroke risk. Um, Mini strokes, so my aunt's at a high risk, kind of scary. Genetics, to know why it happens. Sometimes strokes happen. Hypertension, lifestyle choices, diabetes, high blood pressure, irregular heartbeat, or disease of the heart. What are traditional treatments for it? Angioplasty, stenting, thrombolytic drugs, clot busters, basically to dissolve potential clots that are going to happen, which my aunt is on right now. And then injection of MPD-1 in the brain after a stroke. And then great music therapy methods. Therapeutic instrumental music performance, which is really cool. That's what I was doing when I was younger, and I didn't even know it. Obviously, not professionally. Just using an instrument to get the body to move, motivating the body to move. So a few things that I was reading with physical therapy is pairing it with physical therapy. So having to move a certain way, and then having an instrument there, so like a bell or a drum, things that again motivate you and will help with make the treatment less. I don't know if it's less painful, but less noticeable if you have something else motivate. And then the music therapy inspired speech and language therapy. So the really cool part about these is a lot of times they lose the ability to speak, or the drooping, the muscles in the face when you sing. These are right up my alley vocally because you always use your face and your mouth and your lips when you're singing. So these all motivate a stroke survivor to kind of get those moving and also help them. So a few of them are musical speech stimulus, melodic intonation therapy, rhythmic speech cueing, which I have a video of vocal intonation therapy, and then therapeutic singing, which is also up my alley, and I have an example of that. Take a look at them.
I see a frog. Very good, in front.
That was my example, and she's using rhythmic speech cueing. So she is motivating him, and she's hitting. So she's using shakers, she's using drum, and she's using voice and pictures. So that's such a dynamic way to use music therapy. There's just so many things. I thought that was such a great example. Also, when she hits it and he's speaking, it's also kind of taking his mind off having to speak. You know, he's obviously in there for speech therapy, and it helps that the goal is to hit at the same time and move at the same time. She also shakes. Like I said, it's just a great example of rhythmic speech cueing. And my second example, therapeutic singing.
You beat me. So let's sing, let's slow it down a bit, and that has a lot of those nice S sounds that I know you can do when you sing. Okay, you ready? You are my sunshine, good, my only sunshine. You make me happy when skies are gray. You'll never know, dear, how much I love you.
That was an example of therapeutic singing. That's right up my alley. And she identifies that he needs help with the S's. So she sings, "You are my sunshine," which has tons of S's in it. So I thought that was a really simple and intentional music therapy. And I also was able to go a little bit more into it. Sonification of arm movements in stroke rehabilitation. So sonification was a really scary word when I started reading this. I was like, oh my gosh. But when I looked into the dictionary, I was like, what is it? So it means when we use non-speech sounds to convey quantifiable information. So what it really should say at the top, which will help, I think, everyone understand it, is using music to help mobility in stroke rehabilitation. So using music, right? So a study was done, and this was published in June 2016 and took place in Germany. And it had 25 patients, and they had an experimental group and a control group. And they, like I said, they all had similar problems after having a stroke, which was a limited motor function in their upper limbs. And so like I said, we have two groups. We have the control group and the experimental group. And if you look at them, I compared what each of them were receiving as far as therapy. So the control group receives physiotherapy and 10 days of fake sonification. So basically music therapy in a therapeutic form. And then they did the C scale and interval training. So if you were to imagine a piano, they would do the C scale, and they would C, D, C, E, C, F, C, G, and that just to help that movement, that gross motor skill. The experimental did the same thing. The only difference was when they practiced the scale, the control group had no sound. So they were doing it, and imagine playing, I guess, like on a digital on mute. You're like, oh, that's so not fun. And the results of it, some of it was minor, but generally what came out was reduced joint pain in the experimental group, higher stroke impact scale. The stroke impact scale has a ton of different things like mobility. I guess it has a lot of different categories within it. And like I said, one of them is mobility, speaking, pain, problems, so on and so forth. And it was already way better in our experimental group, and it the end result was overall better hand function. And even though it was minimal, I think that still counts. That every movement is is very monumental when you have a stroke. But I hope you enjoyed, and I'll see you all in Indiana.